Hi guys! So for today's video, we're going to learn something about pharmacology. So here is my sample case. Miss Clark is being seen in the clinic for treatment of rheumatoid arthritis. The physician has prescribed Naproxen for her pain and discomfort. Discuss the information you will give Miss Clark about detecting possible gastrointestinal bleeding. How to solve the case? First, we need to discuss the basic facts in the case study, and here we have rheumatoid arthritis or RA and the Naproxen. So, what is rheumatoid arthritis? Rheumatoid arthritis is a type of an autoimmune disease wherein it creates inflammation that causes tissues in the injured area to thicken, resulting to swell. In our body, we have what we call cyclooxygenase or COX. It produces prostaglandins, which regulates acid secretion of the stomach lining, also called the COX-1, and also responsible for controlling inflammation, or the COX-2. So, how does Naproxen works? Naproxen works by inhibiting the COX-1 and the COX-2. So, when the patient intakes the Naproxen orally, it usually takes 2 to 4 hours of absorption. And then, in the site of the injured area, the prostaglandin is produced. We all know that the prostaglandin is the one that causes inflammation and swelling. So, when the Naproxen goes to the injured tissue, it inhibits the production of the COX-2, so it alleviates the pain. That's for the COX-2. And for the COX-1, the Nsaids Naproxen inhibits the one responsible for protecting our stomach lining from stomach acid. Thus, it causes serious implications such as bleeding in the stomach because there is no one that will protect our gastrointestinal lining from any acids. Gastrointestinal complications is the most common adverse reactions for Naproxen. Common side effects such as headache, insomnia, rash, and dizziness. And then, we are going to the third case fact, wherein how to discuss the information to Miss Clark about detecting possible gastrointestinal bleeding. So, our GI or the gastrointestinal have two parts, which are the upper GI tract and the lower GI tract. So, when you experience vomiting fresh blood, coffee ground, dark exposed blood, and black tarry stools, it is from bleeding in the upper GI tract. But when you experience fresh blood and stool, it is bleeding from the lower GI tract. Since now we know how Naproxen works for pain on rheumatoid arthritis and how it causes bleeding and what could Miss Clark experience, let's now give her some tips. The first tip, don't increase the dose because we all know what can happen with our body with the Naproxen. If we increase more the dosage, we also increase the risk of having serious complications. Second, avoid drinking alcohol because as we said a while ago, Naproxen inhibits the COX-1 which protects the gastrointestinal lining. So if you drink alcohol, it could damage more the GI tract. And the third one, take with food and water. It is to avoid having ulcerations where Naproxen could just aggravate more the ulcer and may cause bleeding. So that's the end of the video and I hope that you learned something. That's it. Thank you!